to Zhangnan, and also I would like to thank the invitation from GNAC. I think this is a very good network. And then I believe it will definitely benefit all of the scholars interested in healthy aging in China. Uh, so today, I would like to just, I only have 30 minutes. I would like to just briefly talk about uh, a topic about disability of later life. Um, disability has been long considered as a central theme for humanity. When people ask anthropologist Margaret Mead, she think that the first evidence of civilization of human beings was actually started from an old fractured femur found in archaeology sites. Because obviously this person has been taken care of after being disabled. And this kind of care indicate that human beings started to be social rather than the wild animal. So for her, this is the clear evidence of civilization of human beings. And disability has been theorized into different models. Uh, I believe many of you already know about this. I mean, the baseline model of disability is the medical model. According to the United Nations, a person with disability usually include those who have long-term physical, mental, intellectual, or sensory impairment, which interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. Um, However, this version of disability model has been challenged. Um, the social model don't think disability should be based on impairment, should be based on medical conditions, but actually it is based on the discriminating social forces. And that is for those physically impaired people, they may not be disabled if the society provide the proper interventions. So the foundational cause of disability is social rather than biological. And this is the well-known the ICF disablement model. And within this model is more clear. You can see disability could be seen into three categories. First of all, is the body function and structures, and which is pretty much referring to the impairment-based disability. And then the daily activities, which basically referring to the personal, daily life. And lastly is more social oriented, referring to participation. So basically, this ICF model kind of differentiate different levels of disability, or in terms of we can call them not as disability actually. We can call them different terms to make things more clear actually. In social science, actually, Warburgi and Jati have this well-known disablement process model. And this is a very informational model. As you can see, for disability to happen, it actually goes through a major pathway. It happens within the body from some pathology, then involved to impairment in terms of structural or functional issues within the body, and then translate to the functional limitations. So people will have limitations in carrying out certain functions. At the end, it comes to the last stage disability, which actually referring to a more comprehensive scope of difficulties in life. There's more related models try to understand disability. For example, the well-known the Loudon's model, person environment fit model. And this model kind of highlight more of the environmental forces determine the limitations and disability of human beings. And related to this model in gerontology, you have a lot of familiar terms such as aging in place, aging in the right place, age-friendly community and city. They could all trace back to the consideration of what is disability, one of the core notions in gerontology. And this is the word the report in disability. I will not spend much time on it, but basically this picture tells us currently about 15% of world population will have certain type of disability. And developed society definitely have less prevalence of disability in contrast to the underdeveloped societies. With regard to disability itself, the word disability, the word report on disability clearly indicate that disability is increasing from about 10% to 15% nowadays. And the major driving force is population aging. So then we can link this core notion of disability to gerontology and social gerontology. So population aging is actually one of the driving force, making the world population to have higher prevalence of disability. And I do recommend you to read about this paper by my colleague, Gu Danan. He actually published this in the Chinese CDC. This paper actually reviewed the world trend, population trend from a global perspective, a historical perspective. So as you can see, in the 1950s, still most of the society is not reaching the aging standard. So when a society have a proportion of older adults over than 7% to 14%, then we call this society as an aging society. And if it is over 14 to 21%, we call it an aged society. 21 to 28, we call it the super aged society. And above 28 is ultra aged. So now in 2020, there's only one country actually just passed the threshold. That is Japan. And very soon in 2050, about 15% of the world population will live in an ultra-aged society. And for China, according to the 7th census, China is right at the percentage is right at 13.5 also. So China is getting into aged society already, actually. So we want to understand disability and especially how population aging is related to disability. And the well-known measurement by many of the researchers is ADL and IADL. And they're actually measuring a very context-based series of difficulties or dependencies, such as eating, bathing, dressing, or some more instrumental functions, such as doing housework, laundering, or managing money. We are all familiar with this. And also, there's other type of measurement related to disability, such as the Nagy style questions asking about the respondent, whether they could crouching, walking for a distance. This type of question is good because it's context-free. It's usually related to an imagined background for people to think about their capacity. So that they are different from ADL and IADL. And for more medical-oriented tests, in the Chinese longitudinal healthy longevity survey, we also use the physical performance, namely, it is purely objective. The respondents need to do it in front of the surveyor. And these tests usually include some performance examinations, such as asking the older people to stand up, to pick up a book, and to turn around. These measurements are actually based on different types of factors. When we think about disability, when we talk about ADL, a person could be ADL disabled because they are not healthy in their body. Or it could be because they are not confident to do something. It could be psychological issues. Or it also could be because of environment. They could be super healthy, but the road or the indoor infrastructure is so disadvantaged. Therefore, they cannot fulfill certain kind of functions. Or it may also because they are short of social support. So based on this map, you can see clearly they are referring to different type of disabilities or different layers of disability. That's why I'm proposing to decompose this. About 10 years ago, we firstly do this type of study by classifying different type of disability. For this study, we actually differentiate 4 types. People with ADL disability, but without physical performance limitations. That's actually quite interesting. Namely, the person is super healthy in terms of physical test, but he or she report they are dependent in certain type of daily life. So why this happen? We actually can see, this is based on the Chinese data, we can see there's a huge amount of people actually have disability in ADL, but perform very well in the physical test, or cannot do the physical test, but report good ADL disability. This discordance is very interesting for us. How come you are physically healthy, but in life you are disabled? And therefore, some further investigation find out these kind of discordance mainly happen in the urban area of China. And we can imagine the situation is some older people, they are healthy, but they do expect or need people to help them in daily life. That could be happen when you have abundant social support resources. Or on the other side, some people may not be healthy in body, but they say, I have no problem in doing those daily life. That could be the people who have shortage of social support. But this mainly happened in the urban China. So along this line, our team started to go further to try to use this kind of thinking to think about one of the major questions in gerontology, that is, can people live long and healthy at the same time? For a long time, people kind of transfer the demographic focus of live longer to be live both longer and healthier. And therefore, the healthy expectancy as a well-known notion has been raised. People start to study the trend of disability. One population is aging. There are some very well-known theory has been proposed, such as compression of morbidity, expansion of morbidity, or the so-called dynamic equilibrium. So this studies basically, there's a recent handbook in this field. And we also just do a literature review on this field. And Dr. Gudanand proposed a very advanced model to understand the trend of disability in 2015. And we are now working on a book, try to empirically test about it. But some preliminary work has been done. This is the work I've been doing this 10 years ago in Shanghai. And we actually reviewed the trend of disability in Shanghai. So clearly Shanghai has a better ADL trend. Namely, Shanghai people are less and less disabled in terms of ADL. And this is more evident for the IADL, which is more environmental sensitive than ADL. We then go further to check the entire China. The entire China also have this trend for the oldest old section in terms of ADL, IADL, and the Nazi style disabilities. And now the question is why we are looking, why, okay, for this type of study, why are you using different kind of measurement? So this is an unpublished result of us. We find some very interesting pattern. For example, we find physical limitation, the real performance-based objective impairment actually are becoming worse. But on the contrary, the self-reported ADL is better and better. That seems intuitively wrong. How come Chinese older people are physically worse, but in the self-reported ADL manner, they say they are better in terms of less disability? This is the paper published at Lancet by Professor Zheng Yi and me and 3 other professors. And it clearly showed the oldest old Chinese having this very interesting trend. In terms of ADL, they are better and better. In terms of physical health, they are worse and worse. So we think there's something behind the scene. That is the substantial improvement of ADL should be mainly attributed to the environment rather than the body itself. So that's the point we are decomposing ADL to understand the observation of disability trend. And it has very big policy implication for us. First of all, if we go back to the theoretical model, if we see less disability and worse impairment, we then have an indirect way to confirm the better disability trend should be driven by something beyond the body, something either because of the individual factor or actual individual factors. We also did something in Shanghai, and we find the improved ADL seems not sustainable because in terms of individual factors, actually, Shanghai are getting worse in the recent years. They are less and less likely to exercise. And just last year, we published this with colleagues to check the entire China about the oldest old. We found a similar pattern. Namely, even though Chinese older people have better ADL disability, in terms of leisure activity, the trend is very negative. They have become more sedentary and salutary. So we call this a dilemma of the public health. Namely, the Chinese ADL trend may not be sustainable. And along this way, we further try to see some very specific disabilities, because the ADL disability, as we always use it in the social survey, but they are very different from each other. And as you can see, this paper show most of the disability happen in bathing and toileting. It happened to be the case that these two things are highly environmental based. When we bathe or toilet, we need a special space. It's highly environmental based. That create a huge space for sociologists and gerontologists to explore beyond the biomedical model. So we cooperated with Shanghai University of Finance and Economics, later with Jilin University, to run the survey in 2014. And I somehow feel this is the first study in China specifically focusing on how older people do toileting and do bathing. So some of our research find, although China is modernized very fast, people are still having different type of ways of doing bathing and toileting. And almost 40% of Chinese older people are still doing toileting outdoors. The implication is there's additional risk for them, particularly in the cold area. Falling down could be a major outcome of having toileting outdoors. And our study actually proved how do you bathe and how do you do toileting affect your health a lot, affect your disability a lot. And we further use the SAGE data to further confirm it, because the SAGE data also containing very good indicators of how people doing toilet. Again, we actually confirm it. Whether its flushing system or not really matters for the disability. And also we do this for bathing. I mean, this is a very recent paper by my student, Jasmine Hall, and myself. We found that for bathing, it's very interesting that China, in the northern part of China, because of the cold weather, difficulty in bathing is way much higher than the other regions of China. So we introduced the environmental factors to understand bathing. So I think I'm running out of time, but let me briefly talk about the policy implications of this line of study. First of all, toileting is a very important issue for older people. The word toilet revolution was firstly targeting on children, but now we propose it should focus more on the older people because of the central position of toileting difficulty in ADL. And related to China, this might be a more important issue because toileting has been considered as a national dream for about 100 years. About 100 years, Professor Zhou Gucheng, when he proposed the future of China, one of the basic standard for him is everyone could use flushing toilet. And even now, we still need to make effort to reach this goal. And this is a historical review of how Chinese toilet revolution happened. As you can see, it's very interesting. The Asian Olympic Games and then the Beijing Olympic Games both play a big role in those movements for Chinese people to have better toileting. And this is some statistics showing we're still on the way to improve basic toileting to benefit more of the Chinese older people. So the Chinese policy of the new Chinese policy on aging has this great theme that to actively respond to population aging. And our proposal is we really need to practice this in all kinds of other policies. In order to reach that, we propose as active responding to policy, population aging has been the national top policy. We need to permeate this kind of rationale to all kind of lifestyles. So we are proposing to renovate the toilet revolution in China by introducing a population aging perspective. When we promote to establish the good toileting facilities in China rural area, we propose to highlight more of the needs of older people. And that's what we mean by introducing the population aging perspective to all kinds of policies. And that is the proper manner for us to actively respond to population aging in China. Okay, that's the last slides of me. Dr. Danengu has published this Encyclopedia of Gerontology and Population Aging just last year, and this is a great achievement, having about over 1,000 chapters, compiling all of the major studies and key terms on population aging. And I hope like this could be helpful for us to promote study of disability in population aging. And also Professor Zheng Yi's Chinese Healthy Longevity Study has finished the most recent wave, the 9th wave in 2020, and more data will be available for interested researchers to investigate for this topic about the disability in population aging in China. Okay, I think I'm running out of time, and that's it. Thank you very much. Yeah.
Okay, thank you. I'll stop recording.